And now we're moving into a forward-looking discussion, looking at the well-being at the heart of every community. And it is, of course, advancing women's health. Sharing their insights on this vital topic are Sophie Smith, founder and CEO of Nabta Health, Dr. Khadija Marashda, CEO of SEHA Clinics, Professor Hassan, Professor of Obstetrics, try saying that 10 times fast, Professor of Obstetrics and Gynecology at Cairo University, Egypt, and your moderator, Jayda Shoukry, producer at Forbes Middle East. Welcome, everybody. Over to you, Jayda.
Hello. Now, I know women's health is usually a very taboo topic. It's become synonymous with underfunding, unfortunately. But I would like to take this moment to remind you that women's health is responsible for a thriving population. We need healthy women for healthy babies, for a healthy workforce, for a healthy economy. So I'm very pleased to be joined by this wonderful group of panelists. Welcome. Now, I want to start with you, Sophie. From a regulatory perspective, what are the healthcare sort of hurdles that you're facing with femtech, and how do you think global markets and the UAE can better support them?
So I think you already alluded to one of them with your opening address, and thank you again for having us here today. Today, women's health accounts for just 4% of funding into clinical research globally. And if you look outside of oncology, just 1% of the total funding that goes into healthcare goes towards women's health, to conditions that affect women differently, or conditions such as endometriosis, polycystic ovary syndrome, etc., that only affect women. If you couple this with the fact that women were excluded globally from clinical trials until 1993, so today, for example, it still takes 4 times longer on average to diagnose women with the same chronic conditions as men, even though they're twice as likely to see a doctor in the first place. Couple that with the fact that 80% of all animal test studies today only involve male test subjects, because women or females are considered to be too hormonally complex and less likely to give a clean result, then you see not only is there a significant need to do more gender-based research, but also more money proportionately that needs to be going into it. So I think perhaps the greatest challenge we face still is a lack of funding into clinical research and innovation in women's health. And then beyond that, the acknowledgement that it is a huge and largely untapped market opportunity, and therefore something that with the proper investment could generate significant returns, not just from a financial perspective, but also in terms of community health outcomes, etc.
Now, we're obviously talking about personalized care in this current era, and the lack of research is obviously a big problem, but what initiatives are we working on at this moment to sort of push personalized care into standard clinical practice? Dr. Khadija.
Okay, thank you for your question. And just to highlight it, before I answer your question, let me also highlight the foundations that we take into considerations based on which we take the principles around which we build this initiative, right? So initiatives has to be affordable, accessible, continuous rather than episodic, and culturally sensitive. And they need to be very well integrated, seamlessly integrated within a system. And they need to follow, speaking about women's health, they need to follow the woman's life throughout her life journey. So it needs to be very well integrated throughout the life journey of the lady. Having said that, SEHA clinics have taken this into considerations whenever we think about any kind of initiative we launch. And this has been done in association and close collaboration with the regulations, whether it's Abu Dhabi Public Health or the Department of Health. And we have designed programs that tackles, from a preventative perspective, different life cycles of women. You would be surprised if I told you about programs that starts from birth. So from birth to the school health, there is a dedicated program that looks into these kind of initiatives that tackles certain health issues based on the lifespan of the woman. Let me give you an example. So after the school health, which is around 17 years of age, once the lady turns into 18, she gets enrolled into another program which is called the Enhanced FHAS program that looks and tackles certain health concerns that emerges in the adulthood. And then not only there, we continue looking after the lady throughout her life cycle, including her premarital staging, conception, prenatal, postnatal, and so on. So having said that, these kind of programs follows the lady throughout her lifespan. And not only that, let's assume that there is a health issue was identified during these preventative programs. Then the health integration is very important, right? To transition from primary care to a secondary kind of care, the transition has to be very smooth, very well integrated, and even if a tertiary care is required from a clinic perspective to a hospital perspective where tertiary care is being provided, this transition has to be smooth and is taken into consideration whether we speak within my SEHA clinics or under the ecosystem of Pure Health.
I'm glad you bring up integration. Now let's dive into integration a bit more. Professor Amr, how do we push more trust and better outcomes through this integration, and how can we scale integration so that it's serving an entire nation, not just a certain ecosystem?
At first, I would like to thank Forbes for this kind of invitation. And I want to say that after all my years working inside maternity units and National Maternal Health Program, one truth remains clear. Respectful, integrated maternity care is not a service, it is a justice. It is the first human right woman meets when she enters health system. Motherhood should be informed, dignified, respectful choice. Respectful, integrated maternity care make it possible. It is not a luxury at all. It is a stress test on health care. Mothers have often been seen as a mean, not an end. Health services have been targeting women in order to help mothers to have healthy babies. But sometimes they are forgetting that there is a woman inside these mothers who has a right to health and survival. Maternity is not a disease. Pregnancy is a privilege, biosocial function, entrusted to women to ensure survival of our species. When women is treated with dignity, her voice and privacy are honored, fear becomes trust, and trust improves outcome. Respectful care is not ethical. It directly improves outcome. It reduces fear, miscommunication. It strengthens trust. Integrated maternity care transform separated health service into one continuum. Here we are talking about preconception, antenatal care, intrapartum, postpartum care. I think that scaling needs national policy, which is clear. When you have first chapter of the book in good way, all the book will be good.
This is wonderful and absolutely true, but I have to ask now, Sophie, when we talk about women, they're not always easy to reach. They're not always in the heart of the city. The clinics aren't always near. How do we reach underserved communities? How do we create real equality in women's health?
Okay, so I think this is a really good question. And when we engage with 25 million women across the Middle East and Africa, we learn two key things. The first is that women are not very good at identifying symptoms as symptoms, for very legitimate reasons. If you have 2 children under the age of 3, you're never going to question the fact that you're tired all the time, because you have 2 children under the age of 3. But this train of thought can extend to getting out of breath, going up the stairs, or having to sit while you make lunches, or feeling like you never have enough energy, all of which could be symptoms of 3 entirely independent underlying health conditions. So that was the first thing. And then the second thing that we learned was, even when a woman is able to identify a symptom as a symptom, because women globally are responsible for 80% of caregiving, 80% of consumption decision-making, we have significantly less time. So we tend to wait, also because of the stigma and the shame attached to women's bodies going wrong at every age and stage, from puberty to postmenopause. We tend to wait until the last possible moment to address symptoms that we recognize. And the problem with the existing healthcare system is that it's a symptomatic system. So care doesn't start until you acknowledge and act on a symptom, whether it's by going to see a doctor or searching on Google or entering something into ChatGPT. So if we want to really build a healthcare system that works for women, we need to proactively engage with them before they develop symptoms. We need to engage with them within communities. We need to engage with them through established population health initiatives that look at things like wellness and engage with them where they are, whether it is at work, in their homes, shopping, in the gyms, etc. And if we can do that, then we can bypass a lot of the issues that we see today in terms of late or misdiagnosis or just women not accessing care at all.
I think definitely information and educating people a bit more would help get them to the clinics sooner. But I'm also wondering, with this approach, if we go for more community-based care models and mobile outreach, what role does SEHA clinics and other primary healthcare givers play in bridging this gap?
So basically, from a primary care perspective, the most important thing is to tackle accessibility to care. Like Sophie has highlighted, ladies would take time before they even present to any kind of physicians to talk about their health issues, and not mentioning the taboo about women's health in the region. So basically, from a primary health perspective, we as SEHA clinics have ensured that whenever there is a community, we are present. We ensure there is accessible time and location-wise to the patients, to the ladies, whenever they want any kind of consultations, even if they don't have any kind of sign and symptoms, just to ask about certain kind of concern that crosses their mind. Having said that, being present across Abu Dhabi, and we have more than 35 centers in Abu Dhabi and Al Ain, we also considered other approach to be even closer to the community, and that includes our mobile solutions, our mobile clinics, where it takes the services right to the doorsteps to the patients. And we're talking about full-fledged of services. Talking about women health, we have mobile trucks that takes mammography to the workplace, to the underserved areas, to the remote areas, to ensure accessible and a very private screening done at the convenience of the lady. To complement all of this also, we have the digital platforms. So telepresence is the era moving forward. And we have invested a lot in teleconsultations. We have to highlight the issue, the accessibility part again. Imagine a world where you sit at home and it's only a button of, tapping a button where you have a full access to healthcare. And here I'm talking about our digital platform, which is Pura, right? So Pura is the digital gateway into the healthcare when it comes to Pure Health umbrella. Patients can download this application, get the right access to whatever service they want at the comfort of their home. And I'm talking not only about general kind of services, but sub-specialized services, including mental health.
And it's also, the best part is that it's trusted. It's not some advice you're finding on a random page that is completely anonymous. You're getting the help you need from the professionals that can actually provide it. And again, this comes back from the idea of building trust and participation and being culturally informed when we're designing these processes. What lessons have we learned and how can we apply them regionally, Professor Amr?
First, I want to say that personalized care without cultural respect is like bridges that leads to nowhere. A woman is not a womb. A woman has a womb. Women health is more than absence of gynecological disease, more than health of mothers. Personalized care must recognize the whole person, her identity, fear, beliefs, culture. For years, an Indian poet once said, too many women in too many countries are speaking the same language of silence. This is no longer the case. Women are now speaking. When we break this silence, we protect future generation and correct an old injustice. This makes culture-informed care not only scientific, but also emotional and moral. Women's rights are human rights. Any system claiming to deliver personalized care must fulfill rights, protect rights, and respect rights. Regional lessons. Listen before prescribing. Replace judgment with compassion. Ensure privacy and female providers. Create space for women to talk.
I think I will echo Professor Amr's words and say we do need to break that silence because, I mean, you can correct me for my facts and figures, but I think this is affecting a third of the population. It's shaping a third of the global burden among people of reproductive age. So I do hope we continue to receive the support needed for women's health. I want to thank my amazing panelists. It's been an absolute pleasure, and thank you so much to the audience.